Hi, it's Dr. Noel Williams, October 8th, 2020, Optimal Health Associates, Oklahoma City, Oklahoma. COVID update. So let's do statistics first, the real statistics, then we'll go through some other stuff. So first, Oklahoma averaging about 12 to 1,300 cases yesterday. It's a little mixed data. Over 1,000 pretty much every day, and excluding Sunday because of data reporting. We're up to 1,075 deaths, and that's an important number because we're going to come back to it. Yesterday, the number was 55,000 new cases in the United States. So a week ago, we were at 37. Now the arc is going to 55. Now, why is the question? Well, I think my theory would be a few things. One, Dr. Birx, I think, brought up a very important point. It's not work, it's not school. It's not work, it's not school. Anyone who starts saying, oh, the kids, look at them and laugh and go, will you please read some data and stop being emotional? It drives me nuts. It's not work. It's not work cases. They be in the news. It's family gatherings. That's what's doing it. It's weddings, funerals, work parties, and then, of course, maybe a little bit of this socialization stuff with football and other things. Don't get mad at me if you like football. I'm just explaining what it is. And that's when you get that many people close together, that's the problem. And so we get some spread. But part of the spread problem is the season is changing and the weather is changing. And for whatever reason, cold and flu viruses that are of this variety pick up in October. That is what happens. And so they get a little more infectious. There's been some mutations that gets COVID a little more infectious. So our case numbers are up. So we really have to be careful now and think socially distance, hands, clean all the time. Masks, those of you who don't want to wear masks, don't wear masks. Those of you who do wear the mask, don't get arguments about it. And people who don't wear masks, and if they get it, they'll learn from getting it. It's that simple. If you don't get it without wearing a mask, God loves you, okay? It's okay. You may have partial immunity. You may have gotten lucky. But the bottom line, if you're hedging your bets, you wear a mask and you're smart. That's what you do. If you don't want to wear a mask, there's nothing anyone can do about it, so don't wear a mask. But you're going to get glared at just like those of us who wear masks, get glared at. But let's talk about deaths for a second. I think Oklahoma is a great microcosm, whatever, of this, where we had 600 deaths on August 7th, 2020. We now have 1,075 deaths on 2 months later on October 7th. So we've had 475 deaths in 2 months. That is a pretty big number, and it's just starting, and the arc of that curve is going up. And that's what we have to think about. Again, are predominantly these people unhealthy? Yes, but again, we don't want anyone to die, even unhealthy people. Everyone has loved ones, we hope, and that's what we believe. I mean, all of us should hope that everyone has loved ones. These people matter to whoever, to their families. So again, we don't want people to die. Now, some people do die who aren't old. There was an OBGYN resident who died in Houston recently, and I was reading about her. And again, second-year OBGYN resident having to take care of COVID patients day in and day out. And she eventually got infected in September, and then she passed recently, just very recently, tragically. And again, it's this, she was 28, immersion subversion. Too many viral particles for too long, all the time, and it overcame her immune system. And that could happen to any of us. So again, be careful, be smart, be safe. So when we think about the politics of all this, which just grows and grows and grows, and it's just getting worse, and if you can try to do something about it in your own gentle way, try to say stop with the politics. Because, for example, the New England Journal of Medicine came out yesterday, and all 30 editors said Trump blew it and he's terrible. Well, one, I don't think it hurts all of us as scientists and physicians to have certain small groups say, oh, someone did it badly. It's particularly, though, a problem when you're just pointing at one person, because I would be more accepting of this if they said, hey, the government blew it, in particular of Burkle, who was in charge of the research for the initial stuff with COVID, Fauci, who's completely failed, Redfield at the CDC, who's completely failed, Robert Cadillac, the preparation secretary, who completely failed. The secretary, Azar, who I think failed. The head of the FDA, Hahn, who failed. And then you included, well, okay, it's everyone and the administration. But to just pick out one person and ignore all the physicians who actually knew about it and who missed it is a problem. Plus, the New England Journal of Medicine has published multiple articles with no statistical validity and confidence about how to manage COVID, nor have they put an editorial out the whole time saying, hey, we need some outpatient guidance from the CDC and FDA. They've done nothing. They've done nothing to help. So they publish journal articles. They've taken the middle teeny box position of big pharma as the only solution. They've never mentioned zinc or vitamins or anything. And then they're criticizing. And I don't think that helps anybody at this point. I think we want to keep away from the politics as doctors and scientists. And that's what's ruined this whole process. And that's why it is what it is. And so enough of that. So finally, take your zinc, take your melatonin, take your multivitamin, take your vitamin D. Clotting. There's more and more episodes of clotting after COVID. Be on your fish oil. I think the fish oil is getting more and more important. If you're a guy, you're my age, you're 56 or you're 50 or you're 45 even, and you happen to be obese or anything like that, you probably want, if you have any signs of COVID, you need to get on a baby aspirin or consider it. Talk to your doctor. That's always my first thing. Talk to your doctor. Talk to your doctor. Don't follow my advice without talking to your doctor. And then if you're a female who gets COVID, you need to notify your doctor and ask about clotting stuff and what you need to do. Clotting stuff is really important because there's more and more people getting pulmonary emboli and blood clots subsequently to their COVID infections. So we have to involve our doctors and involve your providers and push them to help you. And if they just say, hey, go to the ER, or, hey, I don't know what to do, and da-da-da, say, well, figure out what to do then. Hold them accountable. Make them do something. I mean, come on. That's why they're there.
That was actually one of the questions that somebody asked was, what about, they said specifically college-age girls, but girls on birth control pills after they recovered from COVID, are they at a higher risk, or what do they need to do?
I think the preliminary data, which I've said before, is right now, birth control pills always raise the risk of blood clot. They don't raise the risk of blood clot or pulmonary embolism as much as pregnancy, which is 1 in 1,000. Whereas if you're on a birth control pill that contains estrogen, it's 1 in 2,000. Your baseline risk for a blood clot in a premenopausal female is probably somewhere in the range about 1 in 4,000, 1 in 3,000 to 1 in 5,000. So it just depends on different measurements and which papers you're reading. But what happens is, if you have an elevation in clotting parameters, so you have prothrombin 3 deficiency, you have Leiden factor 5 deficiency, you have methylene tetrahydrofolate reductase, genetic issues, it's called MTHFR, and if you have autosomal recessives, you're more clotty. If you have one of those things, you're on an oral contraceptive, you're on oral estrogen, your clotting parameters are more intense, you're more likely to get clot. And then you get the inflammation from COVID, that increases clotting. So if you get COVID and you have an established clotting issue where you're at higher risk for blood clot, or if you're on something that elevates blood clot risk, for example, a birth control pill containing estrogen, even a synthetic progestin can occasionally in some subgroups, or you're on an oral estrogen, you need to really touch base with your doctor if you get COVID and ask them what you should be doing.
Each girl gets COVID, is on birth control, they need to go to their doctor.
Well, they can't go to their doctor if they have COVID.
Right?
No, but you need to call your doctor if you get COVID and you're on a birth control pill or oral estrogen, you need to call your OBGYN or primary care doctor or internist or nurse practitioner or PA and say, I have COVID, which elevates my risk for blood clot over the next month, and I've been on a birth control pill or something that raises my risk for blood clot, and what do I do? And hold them accountable and make sure they tell you to do something and not just go, oh, I don't know. That's not a solution.
Okay. So a couple other questions?
Sure, go ahead.
Do you have more? Okay. Is Zycam just as good as zinc?
No.
Okay.
It's okay, and it's good, something good to suck on when you're traveling, but tastes like, I won't say. So that's why I always recommend elderberry and zinc lozenges instead.
Okay. And are false positives rampant?
Yes. False positives and false negatives. It's both. But there's definitely tons of false positives, but I want to emphasize there's just as many false negatives by most of this data. So lots of false positives, lots of false negatives. In terms of the swabs, we're still a little bit up in the air on the antibodies. I don't think there's much in the way of antibodies being false positive, but there's definitely false negatives. But again, there's some question of what they mean, but I think ultimately it means you have some level of immunity for a while.
Okay, do you recommend teachers doing zinc pulses, and if so, how often?
Okay, so I would, if I was a teacher, what I would do is what we're doing with healthcare providers. Oh, and the study, we have to give the study information out. I will do that tomorrow. I needed the phone number for everyone to call. I would do 150 to 200 milligrams of zinc twice a week as a routine. And just don't take it the rest. So Sunday and Wednesday or Thursday. And then skip it the other days. But you do it with food, again, 50 milligrams 3 times or 30 milligrams 5 times. If you're a bigger person, go to 200.
That's all I have.
Okay, that's it. Thank you. Good night.